My name's Nick Morgan. I'm 25 years old. I was in the Army Reserves for a little over 4 years, and I was deployed to Baghdad, Iraq from February 2004 till February '05. And now I am a member of Iraq Veterans Against the War. Iraq Veterans Against the War has three main goals. First of all is to have immediate withdrawal of all occupying forces in Iraq. Second would be full health care and benefits, including mental health benefits for veterans when they come home, regardless of discharge status. And third is reparations for the Iraqi people so that they can rebuild their country on their own accord. I received disability actually just about a month or two ago. I started receiving 50% disability for post-traumatic stress disorder, and it took about 6 or 7 months before I started receiving benefits from the time I put in my claim. But it's not enough to live on, and in my case, a lot of times I've had difficulty maintaining jobs and working because I don't know how I'm going to be feeling from one minute to another, let alone one day from another. So a little cash to know I'm not starving is that's helping to an extent, but throwing money at a veteran and saying get better isn't really helping in some regards. It was the last presidential debate, and a contingent of Iraq veterans against the war from all up and down the East Coast, from DC to Boston to New York. We simply wanted to have a couple questions asked, or a question asked on behalf of veterans. Our message was entirely nonviolent the entire time, because we even had a couple of our local members up in New York had a conversation with the police officers from Nassau County sometime within a week prior to the event, literally telling them how what our plan of action is gonna be, what it's gonna look like, what if when and if it comes time for them to arrest us, that we're not gonna resist, and our message was entirely nonviolent, and that was made clear ahead of time. We went to the event, and everything had panned out exactly how we had planned. They didn't let us in. We spoke our piece outside, asked a couple questions about veterans benefits. After the contingent of veterans that put themselves in the position to be arrested intentionally, myself not included, once they were arrested, the police officers asked us, because we had crossed the street to go to the entrance of the campus, and the police officers then began ordering us to back up on the sidewalk. Now keep in mind there's 200 or 300 people probably there supporting us, other veterans and groups and people that just happen to be there. So there's a large contingent of people on the crowd, or on the street rather. So we're moving back, and they began being aggressive. The cops standing on the ground, they began pushing us back, and the rest of us veterans who didn't get arrested were standing in line, kind of keeping the cops from pushing around the people that were there supporting us. And then they brought out at some point, and you have to forgive me because a lot of it's kind of blurry to me. Then at some point during this, they brought out the mounted unit, the police officers on horses, and began spinning them into the crowd and using the horses as weapons to push back the crowd. Knocking people on the feet. I got hit in the face before we even made it to the sidewalk, which is where we were being ordered to go. And once we finally got on the sidewalk, the last thing that I remember was the police officer started grabbing people for no apparent reason that I could tell, because at that point we had been following the police orders. We were on the sidewalk, and the last thing I remember is the cops pulling away someone standing in front of me on the sidewalk, and then it's blank, and I'm getting dragged across the street by police officers with blood dripping across my face. And what happened is one of the mounted police officers, in the scuffle of things, one of the horses had stepped on my face and crushed my cheekbone. So what they did, there's a titanium plate that goes across my cheekbone, my zygoma. It was crushed inward. That's permanent, obviously. There's some absorbable plates that are underneath my eye because the orbital was crushed. Those will go away in time. Fortunately, like I said, I had been back from Iraq less than 5 years and had free healthcare at the VA, which is where I got my surgery. My little visit to the Nassau County University Medical Hospital They sent me. I got two separate bills. One was basically doctor's fees, which was $588. The second bill was everything on my CT scan and all that. I don't remember the exact amount. It was somewhere around $4,300. So it was right around $5,000 total, with everything. I got them to slide the scale down. They have a sliding scale for people who can't afford to pay the full amount. But I thought for a Motrin and a couple stitches that was kind of ridiculous. Over the last several years, veterans benefits have gone up at a very low, less than 1%, over the last couple administrations, presidential administrations. And inflation's gone up probably 12% over that time period, at least 20% over that time period. So not only are the benefits marginally adequate, depending on who you're talking to. It's a good thing I don't have anyone else but myself to take care of. I don't have any dependents. We're kind of getting the short end of the stick there, because inflation goes up, the value of the dollar goes down, and we've been getting the same amount of cash for 20 years. Well, I mean, I guess I can just say that it's kind of a sad state of affairs when you have so many people voluntarily and willingly put their life on the line for the country, and then turn around and come home and expect the benefits that are supposedly guaranteed to you, either non-existent or virtually impossible to get to for some veterans, or not getting taken care of in time. It's really just a sad state of affairs, and I think it's an important issue for everybody who wants to show a little respect for people who, like I said, were willing to literally put their life on the line for the country.
To make you angry?
Pardon?
To make you angry?
Yeah, absolutely. It makes me kind of scatterbrained right now, but yeah, it does. It's appalling, and it's frustrating. Very much an uphill battle coming home.
Would you say that veterans, by any stretch of the imagination, are set for life when it comes to healthcare?
Not very many that I know. No.